Hi, this is Brittney Heard. I'm a General Cardiology Fellow from the University of Virginia. We're here at ACC 2019. I'm here with Dr. Velarde from University of Florida in Jacksonville. Thank you so much for taking the time out to talk to us.
Thank you for inviting me, and it's a pleasure for me.
Can you tell us more about what your focus is on?
For a long time, I've been interested in special populations and how cardiovascular disease impacts women and minority populations. And that's part of the work that I do, and part of the work that I hope we as cardiologists impact on our fellows and the fellows that we train. As program director of the fellowship at the University of Florida in Jacksonville, I think it is imperative that we lead by example and teach our future cardiologists what is the population they're going to be treating and what are the special factors that are going to be, that they're going to be facing in terms of cardiovascular risk.
What do you think some of the deficits are mostly when it comes to the minority populations and things that are overlooked the most?
Well, there are still, unfortunately, several in terms of on the provider side and on the patient side, right? On the community is the lack of awareness of risk factors, prevention, primary prevention, secondary prevention. On the provider side, we have to increase the diversity of the physicians and the scientists that, most likely will be viewed in a more positive way from the community because they look like them. So that's just a very simple example of what I see that are gaps. There are also gaps in scientific research when it comes to genomic work. Is specific for sex and race, and so from the basic science to the practical points, you have gaps that need to be addressed. But we're doing so much better, and I think that the college is addressing those with different platforms that run the whole gamut.
Now, will you be talking about that in your talk this year?
I'll be a member of a panel of how ethnicity impacts cardiometabolic risk, and that I think is these are topics that are being more and more are getting ingrained in sessions and in national conferences like this because they're very important, right? We have significant disparities that need to be addressed, and the cardiometabolic risk being one of them that is very pervasive and prevalent in minority communities needs to be addressed, and I'm happy to be part. I'm very excited to be part of that panel.
So, of course, I think communication is a big issue when we're dealing with patients in various minorities communities. What would you say is something that providers who are not the same ethnicity as the patients that they're treating, what are things that they should be doing, and what are some cultural things they should keep in mind when they're interacting with their patients in order to better treat them and to get the adequate information they need?
That's a very good question, and an important one that we as providers and our fellows in training face in the clinics that they attend to when they're in training, and sometimes when they go out in the community to practice, they are not perhaps well prepared. So there are certain programs that teach cultural sensitivity. I think is a good starting point, but the problem is complex, and it's not as easy as, okay, you attend some cultural sensitivity classes and you'll be proficient in these issues. So I think that a need to increase the diversity in the providers that treat those communities, it's key. Improving and enriching that pipeline that would lead to providers that understand that community, that can work in that community. I think that is a more fruitful way of addressing a very complex and difficult problem. For the practicalities of today, when you are dealing, and for fellows that are currently in training, you know that the face of America has been changing for some time, but the minorities and especially mixed race are going to be the majority by 2036. This is going to be in upwards of 110 million people, and it is extremely important that what I just mentioned about the pipeline gets taken into account, and how things are going to look in terms of all these collages of ethnicities and cultures. I think is going to be a beautiful mosaic, and we should encourage bilingualism, trilingualism if we can, in the people that we train and in kids. And so the pipeline, without getting too lost in the theme here, I think is very important. But for today, I think you have to demand that the places that you work at have translation services that are readily available, and it is not something that is an afterthought. You cannot expect that your Spanish-speaking patient, elderly woman, comes in with their granddaughter to translate when the granddaughter may be 10, 11 years old. Those things are things of the past. So you have to demand that those services are available so we can treat the community that we practice at.
Well, thank you so much. Again, this is Dr. Velarde from University of Florida in Jacksonville, and this is ACC 2019. For more videos like this, visit youtube.com/fitsonthego.